Friends, I am Dr. Sanjay Pandey from the Department of Urology at the Kokilaben Dhirubhai Ambani Hospital in Mumbai. It's important for us to be aware and aware again and again that changes happen in men from 40s, 50s onwards to 60s, 70s, 80s, and 90s. The progression of change in hormones brings about two important changes in the region of the prostate, a male organ, which controls the urinary flow through which the urethra actually empties. So, friends, prostate, a male gland, which undergoes a change from 40s, 50s onwards, could be two different changes. One change which I continue to deal in the last 25 years is the progression of obstruction to the flow of urine for men. And men many a times don't pick it up. They many a times miss out that the obstruction, a progressive change, is not looked upon because they never compare with themselves in a public toilet. They never compare with others in the public toilet. And they miss out that the flow is gradually going down. The stream is getting narrow. You have to push and pass urine. You don't empty your bladder completely. You get up multiple times at night. And many a times you've got frequency, urgency, and urge incontinence, or sometimes even leakage of urine. The bottom line is the prostate, a male organ, is undergoing a progressive change. And this change is important for us to know because all men will go through it. Some minor, some moderate, some severe, some very early in life, and some very elderly would be picked up only because it was a delayed pickup. So, friends, it is important for us to have a prostate health checkup. Important for us to be aware that prostate health changing progressively day by day, year by year, and decade by decade can be picked up by your urologist in your cities and your towns. What does it mean? In a man between 40s to 80s who complains of the flow not being good, who takes time to start, takes time to empty, and takes a long time to empty and sometimes doesn't empty his bladder, could have been placed on medical treatment by physician colleagues and by anybody else, but we need to assess him. The assessment is most important. In other words, when we want to know the heart, we do an ECG and know all about the heart, and we go up the ladder in terms of evaluation. Similarly, if as a urologist at the Kokilaben Dhirubhai Ambani Hospital, I need to know how is your prostate health. All that I would ask you is an International Prostate Symptom Score or IPSS symptom score to be downloaded and assess yourself as to what is your score, mild, moderate, or severe. When you come and see me at the Kokilaben Hospital, I would say, is your flow very good? Do you empty your bladder well? Do you get up multiple times a night? And you get to know a lot of answers, which is actually all there, but we never were asked. We ask you to do a test called uroflowmetry. Uroflowmetry is ECG of the bladder. In other words, the graph that comes out when you pass urine in full bladder in a computerized toilet tells me all about what is happening with you. A very, very important test. So, friends, the ECG of the bladder, called the uroflowmetry for a urologist, gives all about your performance status of the lower urinary tract, which you are empowered to empty